Officer with the Jackson County Health Department, Kristin Pluta. Good morning.
Morning.
Morning. Have you ever been to Westwood Wall?
I have not, but I just heard there's a new restaurant in Westwood.
Yeah, there
Wall.
is. Wingity Ann's.
Yeah.
What is
Yeah.
it?
I heard that
Wingity
just
Ann's.
yesterday.
Wingity Wings. It's
Wingity.
wings. Ray
Wingity.
Robinson. It's really good. Wingity
Yeah,
Ann's.
just yesterday someone told me about that.
Yeah.
She said her boyfriend said it's the best
It's
fried chicken
it's
he's ever had.
unbelievable. Yeah, I've had
Where's
it
it
before.
at?
It is in the old Coney Island, right when you walk into the main and to the left. Yeah.
Is father and son shoe still there?
I don't think so. But yeah, Wingity Ann's is awesome. They went from, I think, kind of a food truck cart to this space. So yeah, it's good. Check them out, Wingity Ann's.
Yeah.
Wingity Wings.
Wingity Ann's.
Wingity Ann's.
Okay,
All right.
there you go.
Check it out. Well, we of course, got the COVID pandemic still with us.
Yeah.
Yesterday you released the numbers. We're 250 a week, right about. We're not going up, we're not going down.
No, we're pretty much in a plateau with that right
Yeah.
now. That's still a word I don't like to use.
COVID or even
Even pandemic.
yeah, for
COVID.
sure.
We've been doing a lot of after action, even though we're still in the pandemic,
Right.
but a lot of, even with our emergency preparedness coordinator for the health department specifically, the state health department, and then even our emergency management.
Yeah.
I've sat in on a few of these after actions, and even though it's not over, we're still trying to learn, from what we.
It's
went
amazing. I think one thing that's an advantage, at least in our county, I've been doing a lot of traveling. We do not live on top of each other here at all. It is not busy. It's, so some of the kind of community spread that you hear about in all these big cities, it's just not as prevalent in Jackson.
Very true.
We don't really know how many people are getting COVID though, because only the results from a testing site
Right.
get reported
Yeah.
to you.
Right. Yeah, very rarely do individuals who do a home test contact us or
Yeah,
contact
of course,
anyone.
right.
It's
Yeah.
just there's not a lot to be done. Yeah, most people are have symptoms and
Yeah.
they're mild, and you wait it out.
Yeah.
And
Well,
Are you still vaccinating people?
we are still vaccinating
Great.
people. Yeah, we actually have been doing just in the last month. The immunization clinic has done some outreach and been to some of the nursing homes like Vista Grand Villa.
Oh, wow.
They were just at Vista Grand Villa.
that's great.
Still doing boosters and things for staff and residents. So.
Nice. Well, we want to talk about hearing and vision, and it's perfect that you're talking to both of us because he cannot hear and I can't see.
Oh, okay.
So
Awesome.
I don't think we were privy to these screenings when we were younger, but you guys are offering these screenings, and I know you've been a part of some of the JPS kindergarten roundups, and it's really a great opportunity for you guys to interact with the public and handle some of those services.
Yeah, it's a state mandate
Yeah.
for kids in depending on the grade that the kids are in, get hearing and vision tests. So we have 5 employees at the health department. 4 work through the school year only, and then we have 1 coordinator who does all the summer planning and all of that. So she does not only the hearing and vision screenings through the school year, but then gets everything ready for the next year. So, and then we are in the schools all year long in all the different schools doing those hearing and vision tests for. I guess, hearing is kindergarten, 2nd, and 4th. I have
Okay.
notes.
Yeah.
Vision goes all the way up through 9th grade. So
there
we
you
also
go.
have
Everyone?
clinic hours. Yeah.
Everyone gets tested?
Every kid.
Every
Yeah,
kid?
Every kid. It's a requirement to have those tests before you start kindergarten.
Kristin, I read something this morning that had never crossed my mind, and hearing loss in a child can sometimes mimic a learning disability.
Right. That, and my hearing vision coordinator could probably correct me on this, but I think back whenever the legislation went in that this became required for school age kids to have this. I think part of that I imagine stemmed on that. You've got kids sitting in classroom that can't see or can't hear what the
Right.
teacher is doing. How,
Yeah.
how do you learn?
Yeah, exactly.
Well, when I was a kid, I don't remember if we had that, but the teacher would be really the one that would have to be observant,
Watching that.
and the teacher would move those students to the front if they couldn't hear or see.
Yeah.
But that's, I guess that was the extent of it.
Yeah, that's
I
it.
remember being taken out of class. You probably do, Andy.
Yeah.
Like I remember being
Yeah.
taken out of class. We went to some little small room.
Yep, and they checked
did
you off
that.
and-
And it's that's
Yeah.
essentially the same thing. Technology
Yeah.
and the things that
I
they
remember
use to check
being,
that. But
being nervous about doing that as a kid, but it's nothing to be nervous about.
yeah,
Not
so
at all.
no, not at all. I think it's very easy. They wear headphones for hearing and raise their hand and
Yeah.
cover an eye.
How busy are you guys with the schools during the school year? Is it nonstop?
Yes,
Yeah.
they run from. And then this past year was even busier because they had not been able to be in the schools
Right.
through COVID. So last year was even, catch up,
Yeah.
getting all the kids who hadn't had it done during those, previous years,
Yeah.
and you have to get those off years. So.
So if you detect that student has vision issues or hearing loss, then what?
Then they do a referral. They send information home to the parent and give resources, and then they do follow up on those as well to make sure. So for last year, we did 8,543 vision screenings in
Oh
the
my
school,
gosh.
last school year, and 1,400 of those were referred for,
Oh my
Wow.
for services.
Yeah, I was
So,
going to ask you.
yeah.
If I think I saw something like a national average of 3 out of every 1,000 have a hearing.
Yeah.
But yeah, that's
Yeah.
amazing.
Hearing was less, so which kind of makes sense, just
Yeah.
with what we know as on lay terms that more people have vision issues than hearing
Yeah.
issues. But 6,300 hearing and 120 kids. We found 120 kids.
Wow.
So
If someone can't afford to get their child glasses or whatever, are there resources?
there's resources available, and that's when they do the follow up, the technicians when they come back into the office and on the days that they're not in the schools, they're doing those follow ups on, and then finding out the parents who say, I can't afford that, or I
Yeah.
don't know who to send them to, or
Yeah.
I don't know who who to go to with my insurance. So they give those resources.
So the parent really doesn't have to do anything. The hearing and vision is going to be tested,
Yep.
Yeah.
and then
it's
they
nice.
just,
You should go.
you should go.
Yeah,
Yeah.
I will go. I need to make an eye appointment.
The
right
other
after
thing,
this.
and I didn't add it on my notes or to tell you, so I'm springing this on you, but we just are starting a dental assessment.
Really?
That really aligns with the hearing and vision as well.
That is so smart.
In 2020, Governor Whitmer signed into law I don't know the numbers of it, but a law that requires a dental assessment before they start kindergarten.
Oh, wow.
So it's kind of a soft, although it's a law requiring that right now.
Sure.
The funding is just being distributed. We just got the funding. And just in June, I went to the Board of Commissioners with a contract to partner with Smiles on Wheels.
Wow.
So they're going to do our screening and work at our kindergarten roundups with the hearing
That's
and vision
cool.
and all of those things.
I
So,
imagine that
Yeah.
a lot of these services, taking your child to kindergarten is stressful enough, but being able to have all these health screenings, that's awesome for the
Yep.
parents.
Yep, and that's
Very
our goal. We're
reassuring.
really trying to get back. Again, kindergarten roundups are those things that
Yeah.
were put on pause. So the more services that we can offer, and community partners that can come together
Yeah.
to be a one-stop shop to get your kid into school.
Yeah.
Have either of you been to a farmer's market yet this summer?
I haven't,
I haven't.
I went.
which is weird.
Yeah.
Normally
I
by
haven't.
this time.
I have though a garden. My husband made me a raised garden bed.
Oh.
He handles it now. He made it, so now it's kind of his thing. But he brought in a pile of zucchini. That was
Really?
going crazy. Yeah.
So it's that time
I'm
of
not.
year.
Yeah, it is. There's a lot of people that have
yeah.
done gardens. I don't.
you?
My father-in-law has one. Tomatoes, cucumbers, that
Well,
type of thing.
It's not tomatoes. Not yet. Tomatoes come later.
Yeah.
I don't know
Our
the
tomatoes aren't
seasons
doing-
of them. Well, he
Ours-
eventually will grow tomatoes or grew tomatoes earlier. I don't know the season.
Later.
Okay.
Yeah.
It's starting to, like this weekend, we'll start to see more and more, and just from here on out.
What's with the corn? The corn's not ready yet
Not
either?
yet.
That's
I
late
thought I
this.
just saw
Really?
the Adams Farm Market
Really?
had some
Okay.
corn. Don't quote me. I really did think I saw something that I saw a picture of a corn.
We need to find that corn.
A picture of a corn stalk. So to me, that said, I didn't
That
read the
says we have
article, right?
corn.
That says we have
Corn
corn.
is 4 weeks off,
Really?
according
Really?
to Noah.
4 weeks out.
4 weeks out?
So Noah's
Wow. We'll
All right,
see,
I just
but
saw a picture of a corn. That
maybe
doesn't
it
mean
said
there's
corn.
Well, it
coming
could be
soon.
from Kentucky. Some people drive it up.
Yeah, that's true. That is true.
So, but you were trying to get fresh
Yes.
food to Jackson County
We
residents.
have some fun things coming up. We have our WIC program always hands out Project Fresh coupons.
Okay.
It's part of the state program, and we get a certain number of coupons to hand out to our WIC clients, who then in turn get to go to vendors who take SNAP and can turn those coupons into, basically like cash to get fresh food
That's
from the
awesome.
market. So we are actually working to bring some farmers to our parking lot.
Oh, cool.
And then we have a few dates, I think August 3rd, August 10th, and maybe another one, but we'll get that
That's
information
awesome.
out
That's
to you
gonna be
tomorrow.
great.
But
Great event.
have some other community partners come out again, kind of, I think our Hearing and Vision is going to be out there.
Mm-hmm.
It's August, so it's immunization time, so we might
Kristin,
have a nutritionist out there
That's
to
what-
teach them how to cook the zucchini that I have.
I need to
growing
see a
out of my ears.
nutritionist because I just saw a video the other day of this guy saying apples and grapes aren't good for you and all this stuff. So I need to reassess everything. So I don't know. There's too much nonsense out there.
I can't keep up with that.
If I didn't have a job, because we were just in North Carolina a couple
Yeah.
weeks ago, I would rent a truck, drive it down to North Carolina, buy out a farmer's market, and then drive it up here and park at Bob's Country Store and make $1 million.
Yeah, you probably could do that. You know what? We could do that. We should try that. Now, you're going to be traveling south to Tennessee quite a
I
bit as
am.
your daughter is playing college soccer next year. Have you learned any Southern traditions yet?
I have not, no, no. But I mentioned before the show that she's going down there. We leave on the 27th. We're going to do a little trip in Gatlinburg and then drop her off on the 31st. But I can't wait to hear her call me with a little Southern,
Yeah.
draw. I listened to her. She's going down there to play soccer, and her coach will send them videos and things, giving them
Yeah.
information on what to do. And it's got that. It's that little bit of Southern.
Yeah. Oh, yeah.
I like-
That's easy to pick up
So,
on
but
too.
she's also they're all from there. It's
Yeah.
it's Tennessee Wesleyan University,
Yeah.
so a smaller school down there, and most of the kids down there are from North Carolina, South Carolina,
Yeah.
Northern Georgia, Tennessee. So she has the accent, like Michigan.
Yeah.
What is snow? And
That's awesome.
The health department is hiring.
we have several openings. We just finished or closed our search for a new deputy health officer of community health education promotion. I know I've talked about that before with you. So we are narrowing down. We've got some great candidates, I think, and we are narrowing down those applications and hoping to have some interviews next week. So
Awesome. Cool. Well, thanks for coming by, and thanks for all the
Absolutely.
good you're doing in the community. We appreciate it.
yeah, it's fun. It's fun to come on here and talk about all these other things.
Yeah,
as
for
opposed to
sure.
COVID.
For
So,
sure.
yeah.
Kristin Pluta, Health Officer from Jackson County Health Department. We'll be right back after